So first of all, congratulations for having a newborn. I really congratulate you for having a new life. I was requesting to have your baby so that I can do an assessment of her, around her, and see how well she is. So can I have your consent, please? It's okay. I'll have your baby and take her to the blood service where I can do an assessment on her. Thank you. So we are going to assess our newborn, our unit. We are going to assess head to toe examination. So we are going to start with we are going to assess different parts. We are going to start with the head, then we come to the face, then neck, then chest, then abdomen, then groin area, then extremities, then back, and the neurologic aspect of the head. So we are going to expose only the part that we are assessing at a time. We are going to start with the head. First of all, you place your hand posturally and support the head. Then, in the head, you are going to look on different things. You are going to look for sutures, fontanella, cephalohematoma, and caput accidenium, and subvalve hemorrhage. So you are going to study the sutures. We have this, the front ones here. They are called coronal sutures. Then we have this one. I call it metopic suture. Then we have this one. We call it sagittal suture. Then we have this one, and this one we call them lambdoid sutures. So at this point they meet at a point that is diamond shaped. We call it anterior fontanelle or phlegma. Then we have the posterior one. We call it posterior fontanelle or lambda. And then after that, we are going to look for any swelling that has crossed the sutures. If it's fluid filled, we call it caput accidenium, or if there is any swelling that is blood filled and does not cross the suture, we call it cephalohematoma. And if there is a blood filled area that crosses the suture, we call it subvalve hemorrhage due to the rupture of the necessary veins. So after that, we are going to look at to palpate the scalp and see if there is any part that doesn't have the scalp. We call it cutis aplasia. After the head, we are going to look on the face. So we are going to look on so the hair is evenly distributed. And after that, we are going to measure the circumference of the hair. We are going to use our tape measure. Then we measure from the frontal lobe to the occiput. For our case is 36 centimeter. Then after that, we are going to look on the face. On the face, we are going to examine 4 different facial features. We are going to start with the ears. So on the ears, first of all, we look whether they are symmetrical with the eyes. Yeah. Then you draw another line like this. You look whether the ear is straight. Yeah. Then after that, you look for the ear helix. This one here is okay. Then after that, we look the cross of the ear, whether there is abnormal folding. For our case, it's okay. Then after that, we are going to look at the eyes. On the eyes, first of all, we inspect whether there is any discharge. If there is no discharge, meaning there is no infection, but we are going to administer tetracycline 1% to like a prophylaxis. Then after that, we look for the palpebral fissures. So, for our case, it's horizontal. The eyes are horizontally aligned. Then, for that, after that, we are going to look for the red reflex of the eyes. We are going to cup baby like this that she can open her eyes. Then we list the ophthalmoscope and look for the red reflex of the pupils. Then after that, we are going to assess whether there is coloboma. This is the missing tissues of the eyes. Then after that, we go to the nose. One of the things we look for the nose is the patterns of the nose. Since the neonates are obligate nasal breathers, we look at the patency of the nose. We can use a small French catheter to look for the patency. After that, we look for whether there is any corneal atresia or corneal stenosis. After that, we look for the septum, nasal septum. It's okay. Then we can check whether the baby is breathing well by reading each side of the nose. Then after that, we are going to assess the mouth, the fourth feature of the face. On the mouth, we look outer part. The lips is pink in color. After that, we look the tongue. If there is tongue or there is no tongue, we call it aglossia. If there is tongue but she is not able to push it or lift it, we call it aglossia. Then, if breastfeeding is painful to her, we do what we call frenotomy to release the frenulum that holds the tongue. Then we are done with the head and the face. Look at the neck. At the neck, we are going to expose the neck and a little bit of the shoulder. So at the neck, we look for the redundant skin that is found in conditions like Noonan syndrome or web neck found in Down syndromes. Then we are going to look whether there is Vernix caseosa, because this is the area that it accumulates more. Then we go to look for assess the collarbone to assess for any fracture. So we are going to palpate it inferiorly to ensure there is no step-offs. Then after that, we are going to expose the chest. On the chest, we look the presence of nipples, the type of nipples. We look the separation of the septum of the chest. Then after that, we are going to look whether the nipples there is any discharge and they are symmetrical. And then we are going to look whether the sternum should be flat. If it's concave, we call it that's an abnormality. Or convex, then we are going to look for the circumference of the chest. Circumference of the chest. This here is 30, 36. That is the circumference of our chest. Then after that, we are going to listen on the heart sounds and the lung sounds. Listen to the heart sounds, then on the lung sounds. After that, we come to the abdomen. In the abdomen, we are going to assess if there is any bruises, scars. Then we palpate on each side. On the left to look for the left side. We assess for the splenomegaly or acromegaly on the right side. Then after that, we go to the groin area. We go to the groin area. This is the baby girl. So you are going to assess the genitalia, and whether the labials are intact and the clitoris is fully covered. Then whether there is any stale blood stain or is the menstruation. Then you're going to listen to the femoral pulse and assess for the femoral or hernia. We assess for hernia. Then after that, if it's a male, we assess for epispadias, lycospadias, something like that, and we palpate the testes. So after that, we are going to use 2 maneuvers to assess for any fracture on the hip. We are going to use the Baldos maneuver. So we are going to flex, then apply pressure on the knee joint. If there is no any sound, that means that the baby is okay. Then you will have to look for Sholani maneuver. We flex, then abduct the baby's legs. If the baby is okay, there is no fracture of the hip. So after that, we are going to assess the extremities. We are going to assess the extremities. First of all, we are starting the hands. We look for whether they are of the same size. Yes. We look for extra digits, what we call polydactyl. We look whether the fingers are short, call it brachydactyl, or they are long, we call it arachnodactyl. Then after that, we assess for the legs, so they are the same. After that, we go to look for the reflexes, starting with the sucking reflex. We are going to look whether the extremities are able to flex and extend. They are okay. Then after that, let's look at the back. Look for the cover of the spinal cord and the defect of the spinal cord. Then after that, we look the patency of the anus. You can use a thermometer and assess for the patency of the anus. Then after that, we can look for the Mongolian spot here. Then after that, we are going to look for the reflexes. We are going to start with the sucking reflex. It's able to suck. Then we go to rooting reflex. Yes, after that, come for the grasp reflex, palmar, plantar. Then we do the Babinski reflex. Then after that, you can do the crawling reflex. Then after that, you can do the tonic neck reflex. Yes. Then after that, you can do the stepping reflex. Then after that, we finish with the temperature. So going to look for the startle motor reflex. Then we are going to look for the neurologic aspect. You lift the baby. the head should come with the body to look for sensation. Then after that, whether she is active or dormant like that. Then after that, we change the diaper if it's not clean. Then after that, we will swallow. So Mama Natalie, this is what baby. According to my assessment, she is okay. She is scored very well. My assessment, she is very well, and she can adapt well to the environment. Thank you for your time, and thank you for allowing me to do an assessment to your baby.